Hello everyone, my name is Jamal Stokes and this is my topic about elder abuse by caregivers. Identification of main issues/problems. Elder abuse is described as an intentional act or failure to act by a caregiver or another person in a relationship involving an expectation of trust that causes or creates a risk of harm to an older adult. Elder abuse is considered a critical social, economic, and health problem across the globe, as approximately a total of 10% of adults aged 60 years and above have experienced physical abuse, sexual abuse, psychological, verbal neglect, or financial exploitation. With that being said, elderly Americans lose a total estimated amount of $2.9 billion a year as a result of financial exploitation. In the most heartbreaking cases, it means the complete loss of savings that are earned through decades and decades of hard work. Elder abuse is considered a critical public health issue in the world today, as many adults are affected by these terrible incidences. Adults that survive or go through these cases report higher rates of depression, as they often withdraw from social interactions with others, and many will result in blaming themselves. Ultimately, this results in silence and shame, which magnifies these effects. They also will have higher rates of hospitalization and institutionalization at an estimated annual cost of our nation's healthcare system of $5.3 billion. In doing so, elder abuse also interacts with other public healthcare concerns as well. For example, social isolation becomes associated with many negative health outcomes and also increases the overall risk of abuse. Analysis and evaluation of issues/problems. When further analyzing and evaluating the issues/problems associated with elder abuse by caregivers, it becomes most evident that there are enormous problems with elder abuse, which include physical, psychological, or sexual harm, neglect, and even financial exploitation, as mentioned before. With that being said, the problem becomes bigger than what most people seem to realize. Thus, elder abuse is underreported, as an estimated 1 in 10 older people experience some kind of abuse every year in the United States alone. This becomes a tragedy because since elder abuse is underreported, then the more unlikely we are as a nation to help resolve this issue for the greater good of the healthcare environment as a whole. Thus, the problem cannot get corrected if the small issues don't get fixed within the nursing home establishments and caregiving practices. With that being said, when further evaluating the reasoning as to why members of the nursing home residents may start initiating in forms of elder abuse, it becomes noticeable that nursing home residents may be at higher risk for elder abuse if their facility has careless hiring practices, such as not doing thorough background checks on applicants, having a high staff turnover rate, little administrative oversight, stressful work conditions, and staff members who act coldly or negatively towards their residents. Therefore, if all these problems can become attacked head on in nursing home facilities, then the numbers and amounts of cases with elderly individuals affected will start to diminish. Recommendations on effective solutions/strategies. There are things that we can all do in order to help fight elder abuse. If you are perceived as an older adult, you can stay engaged in your community more, which makes it harder for predators to target you. This also puts elderly individuals in a position to help spot abuse of others. Financial vigilance can also help the elderly individuals as well. This is due to the fact that elderly people usually are drawn towards making huge financial decisions, being tricked into spending money on things that are quite costly. For instance, if an elderly individual hears about some sort of deal, or if they're making a big purchase or investment that seems too good to be true, then chances are they're not. By an elderly individual becoming more aware of these types of situations, they will be more aware of not letting anyone rush them into a decision, and not signing any documents until fully understanding and after a lawyer or trusted family member has checked over them. Therefore, community outreach events can be established in order to help raise awareness of elder abuse towards the elderly community. Nursing home facilities can start implementing monthly briefs on elder abuse to raise the awareness in the establishment of what things are allowed to be done towards their patients. This will make sure that nursing assistants will have a constant memory of what protocols and procedures are allowed to be done. Also, some form of counseling or group can be initiated so that the nurses and home caregivers can talk with one another about their problems dealing with the elderly patients. That way, they can get everything they need off their chests and talk with others about potential solutions to help fix the problem. By doing this, the caregivers will be able to realize that they are not alone in this situation, and there are organizations and people out there that are willing to help them. All right, everybody, this concludes my brief, and I hope you all have a great rest of your day. Thank you for listening.